I had a gentleman in his late 30s come into the office, and even just watching the guy walk in, I did not even need to know what his chief complaint was. Like,
Yeah.
he has a herniated disc in his lumbar spine,
Yeah. You can
and
see it in people.
he couldn't even sit in the chair, right? And he was so miserable. I said to him, "said like I want to get an MRI before we start care," which is not common for me. But he was so absolutely miserable to just even get out of a chair. He had muscles that were weak, a pain radiating down the legs.
Yeah.
So we did an MRI and found out he had a pretty severe disc herniation. It was 11 millimeters, and we started him on non-surgical spinal decompression.
What was his pain level, Dr. Clint, when he started?
Oh,
And
10,
10. Was he
10,
sleeping?
30 minutes a night,
Yeah.
maybe two times, like just out. And you can just see in his face, his
Yeah.
quality of life has gone.
As life force is diminished.
It's, yes, very,
Yeah.
very poor quality of life. And he was frustrated that I wouldn't touch him first day, but I was like, man, I think you either have one really bad disc herniation or you got multiples. We need to
Yeah.
see this before we get in there.
We don't want to guess, right? We want to
No.
see. Hey, everybody. Welcome to the show, Everything Disc from Pain to Performance. I'm excited for today's episode. Got one of my really good colleagues in our profession on our show today. He's from Castle Rock, Colorado, been in practice almost 20 years, Dr. Clint Dickason. And I really appreciate you taking time out of your schedule to tell our listeners what it is that you do. And we're going to talk a little bit about exercise and how we can maybe hack that code a little bit more. So, Dr. Clint, I just want to welcome you to the show today.
Thank you, Dr. Troy. It's great to be here.
Well, good. I'm glad you're here. And I know you're pumped up. You got your bands on today. We'll talk about that in a little bit. But I want to ask you a few questions. I know you've been in practice almost 20 years there in Colorado, and I've seen you countless times at seminars. We've hung out lots. So I know you pretty well. You've been to my clinic. And I want to kind of talk about spinal discs and disc herniations. And we want to kind of talk to kind of the layperson because a lot of people don't understand this. They might go to their doctor and their doctor's like, hey, you got this, and then you need to do surgery. And so people get kind of swallowed up in these medical terms. But let's talk about herniated discs and bulge discs. Do you see these in your practice, and how do you tackle these?
Yeah, I see them all the time, Dr. Troy. And you say that lay people have a tough time understanding them. I personally think healthcare professionals have a tough time understanding them. I think a lot of chiropractors, a lot of medical doctors miss this diagnosis. And then also, when you look at what our medical community is doing, they're changing what they're doing kind of all the time because they're not happy with their results. Just this past weekend, I was at my son's soccer game. I was talking to two separate set of parents, and both of them had had disc surgery. They're not patients of mine. They'd had disc surgery for a discectomy for herniated disc. Both of them said after the surgery, I felt no difference. So now they're scheduled for a second surgery. I said, hey, we do some of this stuff in our office. You now have post-surgical continued back pain syndrome. We got a couple different techniques that we can do chiropractically. I've got some great tables that we do some non-surgical disc decompression on. And it's interesting is they're hesitant, but boy, they're signed up for the second surgery. And one guy is like, well, if I do the second surgery, I'm actually a candidate for an artificial disc replacement. And I was like, holy cow, man, they're just, it's just escalating. And
Yeah.
I think
Yeah.
it's sad that these people, they're not willing to try conservative means because these things, maybe the artificial disc is the fix. I don't know. But man, it's early on and we don't have a lot of research on it. We don't have decades of research on it like we do non-surgical spinal decompression or say like the Cox chiropractic technique, but that we can get some good results of patients and we can show over time, these techniques help take care of these disc cases. So I think healthcare professionals struggle. And I think the big thing is as a healthcare provider, I personally was a disc patient. I had herniated all 5 of my lumbar discs by my late 20s. And that really opens your eyes to like, oh, you mean that chronic recurring lower back pain I've been having that, would get better with some adjustments and not ever fully go away. That was my discs talking to me.
Yeah.
And
Yeah.
until it started traveling down my leg, did I finally go like, oh, wait a second, that's a disc herniation.
Yeah. It
So
takes a while to figure that out.
I think being able to A, personally having gone through that, and then also B, now you start listening to patients a little bit different, and you go, oh man, this is a disc case. And I've
Yeah.
said that to so many patients, and they're like, oh no, 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 it's not a disc. And I'm like, boy, it's that old saying of, sounds like a disc, talks like a disc, walks like a disc. This is a disc. This is a disc problem. And we can say, hey, more than likely you're going to respond to conservative care fairly quickly if we get on this early in your case. And we don't have to have an MRI to diagnose that, because you can just listen to the history. You can do some diagnostic orthopedic tests, dermatomes, myotomes in the office, and you can start to figure out, like, there's some dysfunction here. More than likely it's going to be the disc.
Yeah. Yeah. But in our training, we always say every road leads to a disc problem when you have some sort of spine issue.
And no one teaches you that early on until you start watching these cases over years, and you go, wait a second, every single patient's ending up with a disc herniation. It's like, yeah, because you're right. So all roads end up leading to disc, and then the problem is all discs end up leading to stenosis.
Yeah, absolutely. That's why I want to do this podcast with you, is because there's so many people out there that they go to their, what they call it, their doctor, and then the doctor says you need surgery. And I can't tell you how many times patients come to us and we work on them, and they've had a problem for 10 or 20 years, and they say, I wish somebody would have told me about this sooner. And so that's why I'm glad that you're sharing your wisdom and your knowledge with our listeners, because you can always do surgery, but once they've done surgery, you can't reverse that. If we could help people improve with our techniques, with our non-surgical spinal decompression, the success rate's almost 90%. And when we were talking about these people that have back surgery, there's a 50, 60% failure rate. That's very common. And then the second surgery, the failure rate's even higher. And then the third, it's even higher. And, look at Tiger Woods. He's on his 7th back surgery. They put an artificial disc in. We'll see how that goes. But man, if we could get a hold of these people before, the disc herniates or bulges or ruptures, we're looking good. And then as people get more mature in life, I don't want to say get older, but they
Yeah.
age, you've got to take care of it. It's like driving an old 66, Thunderbird or something. You got to baby it a little bit. You can't treat it like it's 16 again.
Right.
So you get these disc herniations, disc bulges. What are some of the things that patients say they can't do and they wish they could do better when they come to see you?
Well, that varies on ages. I mean, we're finding disc herniations. The youngest I've found is a 12-year-old.
Yeah. Yeah.
Recurring, chronic recurrent lower back pain, playing football. And the dad is been a good patient of mine over the years, because the dad's a disc patient. And the dad said to me, he goes, what the heck is the underlying problem? And I said, I think he's got a disc issue, because the dad has a congenital malformation where L5 is fused to the sacrum, which we found through x-ray. So then the disc above is going to have more wear and tear. I said, we took x-rays, your son has that congenital malformation. I'd be willing to bet that disc above has got too much stress on it because he's pushing himself with the football. We did an MRI, and sure enough, we got a disc herniation.
And have you treated him yet?
So we immediately got him on the non-surgical spinal decompression table, and we immediately started doing the cox flexion distraction adjustment on him, and very quick turnaround. So then, looking at the MRI, we can see that the muscles around that disc are atrophied, and fat's starting to fill in there. So I said,
at 12 years old.
At 12.
Yeah. Wow.
Well,
Yeah.
I mean, if the nerve's not talking to the muscle, what's the muscle going to do? It's going to shrink, and there's no empty spaces in the human body, so it's going to fill in with fat.
Yeah.
So said to the kid, like, hey, we got to build a wall of muscle around this core of yours, and then we got to be smart about our training. So we got him doing planks, and at 12, you would think he'd be able to do some good planks, and he could barely hold it for a minute.
Yeah.
And I said, buddy, you got to get up to 2-3 minutes. I mean, he committed to it. He did. And it's interesting is we found this early on in his football season this fall. And actually his team Saturday night won the Super Bowl for his age group, 8th grade.
Awesome.
Yeah. And he played the whole time. Right. And he played pain.
That's part of.
Yeah. He played pain free because we've been seeing him twice a week. And he's responded fantastic. He's done his homework. He's done his home care. And I think that if we stay on top of this, that he's got the likelihood of having a successful athletic career.
Yeah.
And that's a little different story than your 30, 40, 50-year-old, right?
Yeah. Yeah. Yeah.
So,
Those, the people that Mine started when I was 12. I fell off a three-wheeler, hurt my low back, and I'd had chronic problems pretty much my whole life. And about 15 years ago, I herniated 3 discs, tore 2 of them on MRI. And I mean, I could barely even roll over in bed. I tried everything: traditional chiropractic, acupuncture, massage, everything other than injections and surgery. And a friend of mine introduced me to non-surgical spinal decompression. And I mean, literally, the first treatment, I went, "Wow, I'm going to get better." And I'd had chronic back pain for 10 years where I could barely roll over in bed and I had to be super careful. Here I am, 15 years later, and I can roll over in bed. I get up, move around. And it's been an amazing journey for me. And then, just having doctors like you to collaborate with and just tell the story of how we treat these people and some of the success cases we've seen. Any other success
Well,
cases you want to share?
yeah, just another one I just had. He actually just wrapped up his care. Had a gentleman in his late 30s come into the office, and even just watching the guy walk in, I did not even need to know what his chief complaint was. Like,
Yeah.
he has a herniated disc in his lumbar spine,
Yeah, you can
and
see it in people.
he couldn't even sit in the chair, right? And he was so miserable. I said to him, I said, like, I want to get an MRI before we start care, which is not common for me. But he was so absolutely miserable um, to to just even get out of a chair, to move. He had muscles that were weak, a pain radiating down the legs.
Yeah.
So we did an MRI and found out he had a pretty severe disc herniation. It was 11 millimeters, and we started him on non-surgical spinal decompression.
What was his pain level, Dr. Clint, when he started?
Oh,
And
10,
10. Was he
10.
sleeping?
20, 30 minutes a night,
Yeah.
maybe 2 times, like, just out, and you can just see in his face, his quality of life has gone.
Yeah. His life force is diminished.
It's yes, very,
Yeah.
very poor quality of life, and he was frustrated that I wouldn't touch him first day, but I was like, "Man, you have I think you either have one really bad disc herniation or you got multiples. We need to
Yeah.
see this before we get in there."
Yeah. We don't want to guess, right? We want to see.
No, especially with, I mean, when he had such severe symptoms, it's like, you're a 9 out of 10 pain. Like, people are heading to the ER for stuff like this, and they're ready to do invasive procedures just to regain some type of quality of life.
Yeah. Yeah. They're usually pain motivated. That's what we found with surgery. They want to get out of pain. I mean, I get it. I don't like being in pain. Nobody does.
Yeah, well, and I mean, you can't sleep at night. Like, I remember when I had my discs, I was talking to the chiropractor who was trying to help me, and he was talking about my pain levels, and I was like, "Dude, I don't care about the pain. I need to sleep at night."
Yeah.
And
Yeah. No,
he
that's, yeah.
he couldn't wrap his head around that, and I realized, like, he has no idea where I'm coming from,
Yeah.
which
If you've
then
never experienced it, people go, "Oh, you're just, you're a softie, you're kind of a
yeah,
wuss, just suck it up." And I'm like, when you got back pain and you can't get off the floor and you got to go to the bathroom in a cup or something because you can't get to the toilet, that's back pain.
Dr.
You know?
Troy Dr. Troy, sleep is an automatic function. When it's not working, something seriously is going on,
Yeah,
and you've
absolutely.
gotta get to the bottom of that, like, quickly.
And that's usually what motivates people to call our office. Probably the number one thing they're like, they go, "I can't sleep."
Yeah.
And I wish we could get a hold of them before that. That's why, we do this show. But what was the result of this guy that was a
So the
9, 10 out of
we
10?
just we just did and we started off, 3 times a week at the office because it was severe case, and I just did his final exams literally earlier this week. We just did his final exam. Pain level is a 0 out of 10.
Wow. Yeah.
No activities
Love
of
it.
daily living negatively affected. Literally cries when I ask him how he's doing. It's
That's
just
amazing, man.
awesome.
That's amazing that we can get these kind of results and
Yeah,
just
it's a
help
grown
people feel
man
better.
crying because his back pain went away.
Wow.
It's
I mean,
insane, dude. It's awesome.
yeah. That's why we do this. That's why I wanted to get on the show and just, tell the story because there's so many people out there suffering. So,
Yeah.
I mean, I love it. It's great. And it's been great to see you grow and develop into this new technology. Not new, but it's new to
It
your
was new to
what we're
my
trained
clinic.
in school.
Yeah, and
Yeah.
the we now know the disc is the number one source of pain in the
Yeah.
lower back, and
Yep.
I wasn't taught that in school, and that's only 19 years ago.
Yeah.
So things are changing. I mean, now they're talking about with the discectomies, they used to go in and just clip the disc clean off. Now they're trying to come in from the side to suck out some of the disc material. Like, they're changing what they're doing. Our
Yeah.
research is changing, so you got to stay on top of it.
Yeah. Yeah, I mean, it's always changing. I'm always looking for what's the best thing to help these people get better naturally without invasion. And sometimes, Surgery is necessary to get these people to recover, especially if they got conocoitus syndrome and they're not holding their bowel and their bladder. That's a
Yeah.
surgical emergency, you know. So I'm not afraid to send people, but if we could do conservative first, I know there's this orthopedic surgeon, Kremchek, and he's got spinal decompression and he does surgery, but he says, I'm not going to do surgery until we do decompression first. And I think that's really should be our attitude. Even, you know, we got to get them through the pain and it's no fun. But if we can do conservative, gentle, you know, these people come around. I mean, the success
But
rate's so high.
and your long-term results are just better.
Yeah.
Better quality of life. You have no with non-surgical decompression, you have no downtime. You know, you're immediately able to start getting back to quality of life. Now
Yeah.
it might
There's
take
no
you a little bit, like so
infection.
like say the golf, right? Golfing is a very hard activity for a disc with that being stooped over and then rotating.
Yeah.
So that might take a little bit. You know,
Yeah.
that's a bad activity for discs. So you've really got to build up those muscles. You got to get the pressure off the disc to be able to tolerate an activity like that. And then you, as you know, you better stay on top of that. Just like you got to stay on top of your golf game, otherwise it goes
Yeah, you
down.
gotta manage this, you know, it's like people come in, they're hurting and they complain. I go, "Are you doing your stretches?" And they're like, "No." You doing your nutritional supplements to feed the disc the nutrients?" "No." I'm like, "Okay, what do you expect? You flared yourself up, you know, so let's get back on track and take care of yourself." And, you know, that's what we do. We coach people to help them take care of themselves. So let's transition a little bit because that was really good information for our listeners. And you know, you know, you came across to me about, I don't know, maybe it was a year and a half or 2 years ago, and you know, I had some heart stuff. Was in AFib and had it for 2 years. Didn't know I had it, and then my heart went into VTAC, and then, you know, my heart stopped for about 4 or 5 minutes and had CPR, brought me back, and totally changed everything I've done. And, you know, everybody's like, do you have blockage? You have this? It was, no, I just wore myself out. And at least that's the way I look at it. But you introduced me to the bands, you know, about a year and a half ago,
Yeah.
and I wasn't able to, I'm like, no, I'm not ready for it. But now, you know, I've been pretty religious. I think I missed one day in the last 2 weeks of doing the bands. And so I wanted to talk about that. I see you're wearing them, and you went to a training, you sent me a clip from that. And so I was really excited to kind of talk about that. And then me, I always like to talk a little golf, but maybe at the end you could talk about why golfers should use it. I was at the range the other day warming up, and I put it on, and my coach was like, "What the heck are those?" And I started talking to him about it, and he's like, "Wow, that's cool. Tell us a little bit about the bands. What's the purpose? What have you noticed?"
So B3 bands allows you to do BFR for exercise. So in relationship to disc, one of the great effects of this is with this level of exercise, we can have a shortened time frame and we decrease the load quite a bit. So typically when we're exercising with our B3 bands, we're going to reduce the load by about 70%. So we're doing about 30% of our typical 1 rep max. So it's easier on the joints.
Hmm.
It's not loading. It's not doing more damage, which was that was the problem I had with my disc, because a lot of heavy weightlifting.
Yeah. Yep.
And we're finding that the light weights with the BFR bands from B3 is actually getting better results than the heavy weight training. So for the disc, some of the benefits that are very important is one is we get a big boost in nitric oxide. So
Yeah. Love
we're
it.
improving vascularity throughout the body. As we're doing that, that's one of the issues of the disc. It's avascular or does not get blood supply, right? So we
Yeah.
get to improve vascularity, we get to improve blood flow around the injured disc, or even if it's a healthy disc, we're allowed to maintain that health because the increased vascular permeability or vascular flexibility with the nitric oxide. Another benefit is if we trained a little bit more and we get a little bit better burn with the bands, is we're going to see lactate start to go up, or what most people would have called lactic acid back in the day, right? When you're high school and you thought you're cool, you're calling it lactic acid because it
Yeah.
burns. Well,
Yeah.
now we know it's actually called lactate, blood lactate. And if we can build up the blood lactate levels, we can stimulate growth hormone production. And the growth hormone is going to be fantastic for those joint surfaces.
Yeah.
So those are really going to help those arthritic joints. And now this comes into play for a disc rehab, because typically when you got a disc, you can't do a lot of exercise, right? You're doing very basic, simple core exercises. And sometimes those core exercises are freaking exhausting.
Yeah. And painful.
Yeah. So if we use the B3 bands, we're able to get a better result with those simple exercises. And that gets us better changes from our exercise program. If we
Hmm.
continue to progress with them, we'll actually see if using them during rehab, we cut our rehab time from 30 to 50%. So you're going to reduce your amount of rehab. And then also, if you continue to use them into performance, we'll start to see some better performance. So, like one testimonial we'll see with golf is that we've got golf professionals that have added 10 miles an hour onto their club head speed,
Yeah. That's going to get another 30 yards.
and it actually got them another 50.
50. Okay. 30 to
Another
50
50 yards
yards. Put the
in his
bands on.
early
Do it.
60s. In his early
Wow.
60s, Dr.
Wow.
Troy.
Love it. Oh, man, that's going to
So
improve my golf game.
100% is going to.
Oh, wow. That's pretty
You just
amazing.
you got to use the bands.
Yeah.
So I like to get patients into them early, start doing the rehab early because they'll get quality of life. The nitric oxide also helps to drop pain, which, I mean, talk to anybody with a disc herniation, anything they can do to take the pain from a 7 to a 5, maybe a 4, possibly a 3, they're in.
Yeah. So would you start somebody on a rebounder with the bands? Like
You know what,
just
they got a hot lower back. I would start with just some simple arm stuff.
okay. Okay. Yep.
Maybe the legs. I would start with the legs, and maybe they're doing like a quarter squat, a sissy squat,
Yeah.
whatever
Yeah.
they could do pain free.
Yeah.
I think a rebounder might be a little bit much if they've got a disc that's pretty aggravated, but I think a
Yeah.
rebounder down the road is exactly where you should be because you're getting
Good place
other
to start.
benefits. Yeah, other benefits from the rebounder, right?
Yeah, I know I did my squats this morning and I was like, man, this is great. I was getting a nice burn because I used to lift heavy, like 500-600 pound squats.
Yeah,
And, once you have a disc issue, that's not in the cards anymore unless you want to,
no,
really jack yourself up. So anything else for our listeners with the bands?
I think they're a great thing that could help people really recover, and I think they can help people performance. There's a lot going on with them. We could do another episode on some of the other benefits of them because
Yeah, I'd
there's
love to get you
really a
the guy
lot
who
of
developed
other.
it on here.
Yeah, we should get Dr. Mike. There's a lot of other benefits that come with it, like increased bone density. We're seeing hormone balancing. There's lots of stuff that come from it if people will use it. But for the disc cases, it's great to get that boost of nitric oxide, decrease pain, increase their flexibility or the range of motion, and it
Yeah.
allows them to just cut that rehab time down. So we're going to heal quicker, get back in the game a little faster.
Yeah, I love it. And then we'll put this we'll put a link to the B3 bands on our show notes so people are interested in those they can check it out and rock and roll. And I'm sure you're able to help people. So am I. If they have questions, hit us up.
Yeah.
We're here to help. You're
100%,
in.
man. They've been a
I was
game
gonna say,
changer for me with exercise, like chiropractic was a game changer for me with overall health.
yeah, awesome. Well, Clint, I really appreciate you, Dr. Clint. I really appreciate taking the time out of your busy schedule. I just know he's Clint, because we've been hanging out for so long. So, but officially, a doctor. Thank you for your time. And it's all about going from pain to performance. That's why we're doing this show, to help people get out of pain and then be able to perform their life better. So, Dr. Clint, I appreciate your time with us today, and I look forward to doing another one in the future we can deep dive more into the bands.
Awesome, Dr. Troy. Thank you for your time.
Hey, thank you.
It was my pleasure.